Lisa visits Paradise Medspa to begin her skin treatments that will tone, rejuvenate, and make her skin look years younger.
Hi.
Hi, how are you?
I'm good. How are you doing?
Good, how can I help you?
I have an appointment today for initial consultation.
Hi, Lisa.
Hi.
Dr. Weiss.
Nice to
I
meet you,
think
Dr. Weiss.
we've met before.
Yeah.
You excited?
Good to see you again. I'm very
All
excited.
right, I am too. Come on with me.
All right.
Okay, so we're going to start off today by doing a visio analysis on your skin. Have you ever had a visio analysis done? Mm-hmm. Okay, it's really fun. It's not meant to be scare tactics or anything like that. We're going to take some pictures using the visio camera. It's going to take 3 different views of your face. What it's going to do is it's going to use a computer analysis to grade your skin. It's going to compare you to other people your age and score you based on sun damage, based on wrinkles, texture, pores, bacteria on your skin, and the things that we can do to enhance your appearance, to improve upon the condition of your skin based on the readings.
Great.
Okay, sound like?
Excited.
Yeah, sounds fun? Okay, close your eyes for me. Okay. You're gonna see a couple flashes go off. It's gonna show us sun damage on 3 different levels. It'll show us the sun damage that we can see on the surface of your skin, and then 2 layers beneath that you can't yet see.
Okay.
This computer analysis even shows us how you can expect your skin to age in the next 5 to 7 years, which is really interesting. So what you're looking at up here on the big screen is the visible sunspots that we can see on the surface of your skin. So it's telling us that your percentile score is 78%. So that means if you take 100 people your age, you're better than 78 of them. So that's really good. If we go down a layer to the UV spots, this is going to be the layer down that you can't yet see. So you've got more down here. So I consider a score anything above 3 to be significant. Your score is 4.8. And again, this is the left side of your face, so you probably have more sun damage on this side of your face just from sun exposure from driving. Okay, so the natural progression of sun damage is that the sun's rays come through the top layer into the deepest layer of skin where the melanin is produced. So this is where the heart of your sun damage lies right now. Okay, you can expect a certain amount of those melanin containing cells to reach the surface of your skin in about 20 years. Okay, so this isn't, you're not going to start seeing this right away, but it just harkens to the fact that you need to prevent. Okay, so prevention, prevention, prevention. It's the cheapest thing you can do as an anti-aging treatment is just to wear a sunscreen with an SPF of 30 or more every day.
Okay.
So like the pigment we saw on the surface of your skin, the brown pigment,
Right.
Photofacials can be used to target that brown pigment. So anything brown, anything red will be targeted by that wavelength of light that we use for a photofacial. And it kind of blows it out of the cell and then it just fades. So I was thinking that towards the end of your makeover experience that we would do a light chemical peel on you just to give you that final glow. Now if we look to porphyrins are going to be pores that are clogged with a bit of bacteria. So this you've got quite a bit of. Right, and so I think probably getting you scheduled for just a detox facial to clean that out. The other thing that I love for this is the Clairsonic brush. It's made by the same people who made the Sonicare toothbrush, and it's a brush that you can use at home. And it too exfoliates, so it's a home exfoliating treatment that you can do every day.
I was wondering if any of these type of procedures work in this area as well.
Absolutely.
I noticed, I really didn't think about it myself, but my husband brought me a necklace for Christmas and took a picture. And when I looked at that picture, I was like, oh my God, my chest looks so old.
So I would suggest, well, first of all, any product that you apply on your skin, you always want to carry it down onto your neck and your chest, okay? Because all that, you don't want it to just have anti-aging for your face. You want it to, even it out all the way down. All right, well, I'm excited for you. Ready to get started.
Me too. Thank you very much.
You're welcome. Okay, Janet, we've got some recommendations for her skincare here. Okay. So I'd like us to kind of gather up these particular products. I've already told her how she's to use them in her daily regimen. And then let's get her one of our bags to put all of her goodies in.
Okay.
Okay, then I'll have to look at
great.
the schedule and get her scheduled for her first treatment.
Okay, sounds terrific, thanks.
Dr. Ali Mosharrafa puts Lisa at ease during her pre-op appointment.
What can be done to improve the appearance around the eyes is a procedure called a blepharoplasty. And a blepharoplasty can be done to the upper lids, the lower lids, or all 4. And if you look forward, I'm going to show you that it's this fold of skin and a little bit of fatty tissue that starts to settle on the eyelid that makes us look tired. The eye actually closes a little bit more than it's used to, and it essentially creates a heaviness that happens as we age. Yours is real. It's not advanced, but it's real. And this can be addressed by removing the skin and fatty tissue that's redundant here and replacing it with a scar that's tucked way back in the crease there. You'll spend one night in the recovery room, so you actually won't go home the day of surgery, you'll go home the morning after surgery. So you and I will sit down just like this in 3 months, look at your before and after pictures so you can see the change. That's actually the most fun of the whole experience, so you can see what we've done. When you go home, you'll be walking. In fact, you get up and walk the morning after surgery. The nurses will help you with that. So it should be a natural change, something that doesn't jump out at you, but is a nice, positive, refreshed, awake look without an overdone, startled look.
Yeah, that looks great.
And we pride ourselves, obviously, on the work we do here as a very natural change. That's very important. The recovery is about between 2 and 4 weeks, depending on what you are ready to do. Okay. And then I would say 4 to 6 weeks before we get you back to exercise and start resuming a relatively normal life. I want to talk to you next about the breast procedure. And this is very common for women who have gastric bypass surgery or women who've lost weight. We're going to talk about 2 things for your breasts. First is a breast augmentation to give you that extra volume, which you want to go up about 1 cup size, which is going to be an implant that helps you with that. And the second is going to be what's called a breast lift or a mastopexy. Both of those can be done at the same time, and the goal is to make your breast fuller and perkier, if you will, more youthful. We're looking at about 300 to 350 cc's. And the reason is we're going to be removing quite a bit of skin from your breast to do the lift. And so some of that is volume to your breast that we need to compensate for with the implant. But I'm envisioning about 325 to 350 cc's as your implant volume to bring you up to the size you're looking for.
Right after the break, surgery is the next step for Lisa, so don't go away.